when there has been a lot of changes in the guidelines. And in fact, we, the diabetologists in India, have been using combinations from the beginning of the diagnosis of type 2 diabetes. But unfortunately, the guidelines has always been telling use monotherapy, wait for 3 months, then do what is called step pattern. First, you use metformin, then you start using sulfonylurea, and then you start basal insulins, etc. But now, I think people have come to terms with the fact that you can actually, from the beginning itself, target the multiple pathophysiology of type 2 diabetes using a combination of agents. So therefore, if you have an HbA1c of 8.5 to start with, which is the case in India, you should remember from the epidemiological point of view, I'm working on a new paper. The average HbA1c at diagnosis is more than 8.5 in India compared to less than 8 in United States. So therefore, using a combination therapy from the beginning is absolutely justifiable, especially if your patients who already have early decrease EGFR, already had history of family history of myocardial infarction, etc. Therefore, after metformin, even before metformin, if the HbA1c is already 8.5 and above, you want to use a drug which can be an agents or multiple agents or a combination of agents which can actually target different pathophysiology of type 2 diabetes. I want to stress on this point. And a combination of a DPP-4 inhibitor like linagliptin and an SGLT inhibitor like empagliflozin is a ideal combination because both of them do not produce hypoglycemia. One of the most important risk factor for aggressive therapy in early diabetes is hypoglycemia, especially when you are using sulfonylurea or insulin. Therefore, the combination of a DPP-4 inhibitor and an SGLT inhibitor is an ideal combination to start early in the treatment of type 2 diabetes. For the first reason, it targets different pathophysiology. Second reason, it doesn't produce hypoglycemia. Third reason, it reduces the HbA1c to up to 1.8%. And fourth reason, it is in the long run reduces the risk of cardiovascular and renal complications. So there is no doubt that Indian patients will definitely benefit from such a fixed combination from the beginning itself, especially if their HbA1c is above 8.5 to start with. Thank you.